Hi, my name's Matthew. I'm a Senior Physiotherapist at myPhysioSA, and I'm currently working in partnership with the International Spine Centre in Wakefield Street Clinic and also in the Hills Integrated Pain Team at one of our Mount Barker clinics. I'm here to talk to you today about just some general guidelines about management post-spinal surgery. After spinal surgery, there is always going to be an immediate post-surgical recovery period where you're going to be in hospital, and in that time the goals are to really get you up, moving around, to get your pain under control and to get you to a point where you're safe to be able to get back home. But once you get to that stage, there's actually quite a few things that you can do to try and actually help your recovery from back surgery. So the first one is to think about keeping up with the pain relief that has been prescribed by the doctors, because if you can keep on top of that pain management, it's going to help you a little bit to be able to keep moving and keep active with the day-to-day activities that you need to do. The second thing is actually to try and do some walking. One of the most beneficial activities post-surgery is to actually get out and to do a little walk. And you don't need to push yourself too much, but as long as you're actually trying to do it every day and that you're trying to gradually increase your walking tolerance over the first 4 to 6 weeks so that you can do about 30 minutes of walking a day. The next thing to think about is that movement is actually very important. So in talking about movement, it is essential that you check with your surgeon what their specific post-op protocol is, because there are sometimes certain precautions that we need to make sure of when you're actually doing exercise. But once we're clear of those and we know we're able to actually get you to do some exercise and movement, it's actually really helpful to get you moving as soon as possible. And we would always follow a graded exercise program to actually expose your tissues to increase the strength and increase your general conditioning post-surgery. And the last thing I think is talking about changing your positions regularly and to think about your postures. So what we would recommend is that you avoid sitting in one position for too long, but at the same time avoid lying down for too long and avoid standing for too long. So it's really about keeping you moving and changing positions regularly. Thank you for listening to this talk, and if you ever need more advice or any guidance post back surgery, then please feel free to get in touch. Thank you.